We're here to tell you about some of the things that have been happening between our two organisations over the last few months. We've been working really closely together as two senior executive teams, working on how we could do things differently across the two organisations to join up care pathways for patients. We've had lots of regular meetings as well as regular board-to-board meetings, and it culminated on the end of May in the two boards signing a memorandum of understanding where we're all going to work much more closely together with a single management structure between the two organisations and looking at having a group board that there'll be delegated authority from both boards too, and we'll be able to work much more closely on making a difference for patients.
The two organisations in many ways are very similar. We are both clinically led organisations, and I think we have very similar visions and are totally committed to delivering the best possible care we can to those people who use our services. And what's become quite apparent over the last 6 months is that we have many patients and service users who are using the services of both Musgrove Park and Somerset Partnership, but often the care they're receiving is a consequence of the fact that the two organisations work quite separately on occasions is quite disjointed and fragmented, and certainly not as easy as it should be for patients and service users to navigate. So what we want to do is work far more collaboratively and formalise our partnership so we can deliver better joined up care for all our patients.
Let me give you one example of a patient who really didn't get the best experience of her care because of the current model between our two organisations. And her name is Mary, and she came into our hospital several times because she was getting a bit more frail at home. And each time we instigated a care package for her to look after her better in her home, and each time she cancelled that care package. In fact, she came in the end 5 times. In the end, unfortunately for Mary, she's had to go to a residential home and lose her precious dog. When we actually talked about that particular patient with our colleagues in Somerset Partnership, we discovered that actually Mary's underlying problem was principally depression and isolation. And if we'd worked differently together, we feel fairly sure we would have had a much better outcome for Mary.
Unfortunately, cases like Mary are not unusual. We've identified many other cases where our two organisations have been trying to support people and not doing that as well as we would like.
We're already working really well together on certain key projects, but there's many more to come. So our two stroke teams have got together between our community team and our hospital team to look at how we could provide stroke care in a much better way for our patients. Our therapies teams have got together and also looked at shadowing each other and how they could work quite differently around the patient's needs. There are many more projects to come, and we're very, very keen that if you have any ideas about how you could do things differently, working with our two sets of colleagues across the two organisations, it'd be really great if you could let us know.
From a mental health perspective, we are really excited that we're now developing a liaison psychiatry service here at Musgrove Park, which we will do in conjunction with our colleagues here. We're also keen to develop the perinatal service that's already linking well with the obstetric teams here. There are many other areas where I think we can collaborate far better than we have done historically. And what I think is really encouraging is that the two sets of clinicians are really keen for this to happen. They want us to work differently. They want us to break down those barriers that have been an inconvenience to them and have prevented them from delivering truly integrated care that delivers the best possible outcomes to our patients.
So thank you for watching Team Brief. We're very keen that we listen to your views and hear the ideas that you have to make this partnership work even better. Please do come and see me at my exec drop-ins, and Nick is also available for people to talk to.